Hey there, welcome back to my channel. I'm Dr.Devi Sundar, Integrative Mind-Body Consultant. Over the past 23 years, I work with hundreds of people living with chronic lung disease like COPD, asthma, ILD, and bronchiectasis. And one pattern I saw again and again was many people with COPD were also living with diabetes and digestive issues, especially IBS, irritable bowel syndrome. Yet, these conditions were almost always treated separately. Different clinics, different advice, different priorities. But the body doesn't work in silos. It works as one integrated system. Breath, digestion, metabolism, nervous system, and mind. In this video, I want to explore the complex connection between COPD, diabetes, and IBS and what the modern medicine, neuroscience, and Ayurvedic wisdom says about it. At the end of the video, I want to share 4 mind-body action plans to empower this complex interplay of chronic illness, COPD, diabetes, and IBS. So stay until the end of the video so you don't miss it. From modern medicine, we know that COPD, diabetes, and IBS share common mechanism: chronic low-grade inflammation, autonomic nervous system dysregulation, altered gut-lung axis, sleep disturbance, and fatigue. Poor glucose control increases the inflammation and affects the respiratory muscle function. Chronic breathlessness increases the stress hormones like cortisol and worsens the insulin resistance and gut sensitivity. This has been clearly informed in a narrative review examining the shared pathophysiology mechanism, including the systemic inflammation and insulin resistance, and the clinical implications of co-occurrence of COPD and type 2 diabetes. It discusses how pro-inflammatory cytokines like TNF-alpha and IL-6 in COPD contribute to impaired glucose metabolism and worsens the clinical outcome. And another paper, which also a review paper describing how metabolic syndrome includes the insulin resistance and hypoglycemia more frequently in COPD is linked with systemic inflammation. Another recent multi-omic study using machine learning identified immune and metabolism related biomarkers shared between COPD and diabetes, suggesting a common molecular pathways potentially driving both conditions. Adding to this, a population-based study showing that metabolic syndrome increases the risk of small airway dysfunctions and COPD, mediated significantly by the inflammatory markers like CRP, C-reactive protein, and IL-6, interleukin-6, illustrating the overlapping inflammatory burden across metabolic and pulmonary systems. A follow-up study shows that there is a connection between the gut microbiome and the respiratory function decline in COPD patients, supporting the link between the gut health and the respiratory outcomes. A large retrospective cohort study shows that the people with IBS had significantly higher risk of developing COPD compared to those without IBS, highlighting the potential clinical links between the gut dysfunction and the respiratory disease. Another review summarizes how immune mediators and microbial dysbiosis can link the intestinal environment and lung inflammation, providing evidence for the bidirectional gut-lung connection. So these papers evidence that IBS in particular in COPD is strongly linked to the gut-brain connection, not structural damage. From neuroscience, we understand that the gut, lungs, and brain constantly communicate via the vagus nerve. Chronic breathlessness sensitizes the threat pathway in the brain. This heightens the gut reactivity, pain perception, bloating, and bowel irregularity. So breathlessness doesn't just affect the lungs, it affects the digestion too. Ayurveda described this long before the modern diagnosis. COPD reflects vata imbalance, irregular breath, dryness, anxiety. Diabetes relates to kapha and pitta disturbances, heaviness, inflammation, and metabolic strain. IBS is often a disorder of vata, affecting the digestion, irregularity, bloating, and discomfort. So when vata is disturbed, both breath and digestion loses its rhythm. Different language, same interconnected system. So people with chronic respiratory disease living with this triad carries a significant emotional load. People often tell me my breathing affects my stomach. My gut symptoms flare up when I'm anxious or breathless. I don't trust my body anymore. Neuroscience calls this visceral threat sensitization. Ayurveda would say prana and agni, life force and digestive fire, are disrupted. This is not weakness, it's nervous system stuck in a survival mode. So here's my 4 mind-body action plans. The first one is regulate the breath to calm the gut and metabolism. Gentle nasal breathing and long exhalation stimulates the vagus nerve, supporting the lung function, blood sugar stability, and gut motility. Second, eat, move, and breathe rhythmically. Irregular routines versus IBS, glucose swings, and breathlessness. Ayurveda calls this dinacharya. Modern medicine calls it as circadian rhythm. Third, movement without threat. Breath phase walking or gentle feet movements retrains the brain. Movement is safe, reducing that gut reactivity and improving insulin sensitivity. Fourth, compassion changes physiology. Self-criticism increases gut sensitivity and breath panic. Gentle awareness lowers stress hormones and improves symptoms. Having COPD, diabetes, IBS doesn't mean your body is failing. It means your system needs integration, rhythm, and safety, not pressure or perfection. When breath, digestion, and metabolism are supported together, regulation becomes possible again. If you're over 40 and feeling breathless, fatigued, and struggling with digestion, I invite you to my 14-day Breathe to Try program, a gentle daily reset for your breath, gut, and nervous system balance. If you're living with breathlessness, IBS, or any long-term condition, my breathing program supports patients in understanding how breath, anxiety, and digestions are connected. And if you're a healthcare professional, therapist, or a coach, I offer professional training in respiratory psychology, integrating pulmonary rehab, that is lung rehabilitation, neuroscience, modern medicine, and integrative perspectives in Ayurveda. Thank you for listening and staying until the end of this video. Be gentle with your breath and your body. It has been adapting for a long time. Until my next video, stay curious, stay healthy. Signing off, Devi Sundar.